everybody. So because so this session is very special. So we just call that satellite meeting agenda. So because this is a new topic, and then so a lot of speakers. So we got all together we got 8 speakers, and then we only have 1 hour. So that's why we need to be the speaker's time to be very limited. So I suppose everybody can speak only 6 minutes. So otherwise, then we'll be running out of the time. So and also the whole schedule is very tight. So today we have this topic with hydrogen antioxidation and lung diseases. This is new field, and also a lot of questions remain unsolved. I suppose maybe Professor Bai would like to talk a little bit because 2 of us, so we'll be chairing this meeting. Professor Bai.
Thank you, Professor. It's my honor to chair this issue, satellite meeting with Professor Zhong. Professor is the well-known professor for respiratory medicine. Firstly, he will give us a brief of keynote introduction of the satellite meeting. It's also a new generation for future therapy with hydrogen.
Okay. So we I suppose we have to start with Dr. Wei-jie Guan, the first speaker. Perhaps you also will talk. Is that the second question will be also you? So on behalf of Dr. Zhang. So okay. Dr. Guan is coming from Guangzhou University Institute of Respiratory Disease. This topic will be effectiveness and the safety of hydrogen inhalation on adjuvant therapy of stable bronchiectasis, a multi-center randomized double-blind clinical trial. Dr. Guan.
So good morning, everybody. So great honor to be here. Thanks, Professor Zhong and Professor Bai. I also would like to sincerely thank the organizer of the meeting, Shanghai Medical Technology Company. So very briefly, I will introduce the background regarding the oxidative stress and chronic respiratory diseases. This is also a rationale for the hydrogen inhalation therapy. So I'm Dr. Wei-jie Guan from State Key Laboratory of Respiratory Disease. So as we know, oxidative stress has already been documented a couple of years ago. So even in normal individuals, there is a balance between the oxidative process and the counter-oxidation. So this is a key related to the equilibrium between the oxidation and reduction. However, in diseases such as respiratory diseases, there is a disequilibrium related to the oxidative stress. So, in principle, there is a significant increase in the content of oxidants and the reduction in the levels of antioxidants. So, anyway, oxidative stress has been implicated in various respiratory diseases such as asthma, COPD, and bronchiectasis. There has been some literature regarding some specific markers related to oxidative stress in respiratory diseases. Such as in this slide, as we know it, that Bartoli and colleagues have reported that there was significantly increased levels of malondialdehyde, MDA, in patients with bronchiectasis, in severe asthma, and also in different degrees of COPD, even when patients remaining clinically stable. Moreover, there was a significant negative association between MDA level and FEV1, a key spirometry parameter. Moreover, there has been some efforts in reducing the oxidative stress in respiratory disease. For example, the study conducted by Professor Zheng in our state laboratory, Professor Zhang and colleagues use a high-dose N-acetylcysteine. Usually, this is also a mucolytic. However, this mucolytic harbors the bio group that is thought to convert antioxidative capacity. Because also not shown in this slide that some colleagues abroad have conducted a clinical trial using the routine doses of NAC. However, they did not find significant reduction in the acute exacerbation of COPD. But notably, the high dose NAC did result in a significant reduction in COPD exacerbations. And this effect was more significantly addressed in patients with moderate COPD as compared with those with severe COPD, as displayed in the right panel here. Why? Because the conventional dose NAC is typically 600 micrograms daily. However, this might not be sufficient to fully exert the antioxidative capacity. When using a high dose, for instance, in this study, 1,200 milligrams daily would be sufficient to demonstrate antioxidative capacity, which might translate into significantly reduced annual rate of COPD exacerbation. So this is a very key research published in Lancet Respiratory Medicine in the year 2014. Moreover, there has been some efforts in reducing oxidative stress in patients with bronchiectasis. So this is the study published in Respiratory by Diego and colleagues. They have found that NAC confer no remarkable effects on the oxidative stress markers in patients with bronchiectasis, although there was indeed some improvements in other clinical variables. So, what's the next goal? So, as we demonstrate, these are the routine mucolytics that has antioxidative capacities. But some patients in our clinical practice would deny the use of medication because in their perception, any medication would confer significant adverse effects. However, is there any safer ways to confer the antioxidative capacity? Now that we do have some powerful tools. Now, hydrogen, as we know it, is the first element, the chemical element in our universe. It constitutes the vast majority of the chemical elements in the universe. And more importantly, because previously hydrogen has not been recognized as an antioxidant, but in the year 2007, the Japanese colleagues were the first to fully demonstrate in the animal model of the potential effects of hydrogen as a very powerful antioxidant. They have shown that the hydrogen inhalation was effective in ameliorating the ischemia reperfusion injury. So this was a landmark study published in Nature Medicine. And this was followed by a series of publications because of the limitation of the time. I will not show them details in this talk. However, various animal studies and some pilot clinical trials have already very clearly demonstrated the efficacy of hydrogen inhalation and the injection of hydrogen water in the treatment of different diseases, including hypertension, cancer, diabetes, and so on. However, there has not been some very formal study conducted in respiratory diseases in humans. We suppose that hydrogen therapy might be a very suitable candidate for the treatment of respiratory diseases. Why? Because first of all, it has a very low molecular weight, just 2.0, the lowest molecular weight marker of all. And this suggests that it is very easy to penetrate to any human tissue. That suggests that hydrogen might exert its effect in different tissues in our body. And second, this relates to the specificity of hydrogen because we have known that hydrogen does not quench the reactive oxygen species responsible for normal cellular stirring. That is very important because this will suggest that hydrogen will not interfere the normal function of the body, but it does quench the excessive oxidants during the oxidative stress, so really useful. And it has also very high compatibility with the tissues. It will not cause excessive injury to the normal tissues. And finally, it would release very rapidly because of its low molecular weight. It would have a very low resistance when delivered through the airways. So in other words, when inhaling the hydrogen gas, it can be very readily delivered to the lungs and then throughout the body. So, as we know that Shanghai and Latvia Medicare company has devised a medical instrument that is capable of generating the hydrogen-oxygen mixed gas. In this instrument, it is capable of generating the hydrogen gas at the flow rate of 6 liters per minute. There are some other home instruments that are able to produce hydrogen at an airflow of 3 liters per minute. So in this way, it is very easy to inhale the hydrogen through the facial mask or nasal cannula. So this is a typical example during the experiencing of patients. So with these in mind, we do have the hypothesis that hydrogen inhalation therapy will be effective for treatment of bronchiectasis. As we know that bronchiectasis is a very significant chronic respiratory disease, particularly in Oriental countries like China. Bronchiectasis has long been neglected by respiratory physicians. However, this disease causes very significantly negative impacts on the patients. And more importantly, there has been very few options for the treatment. So we now do suspect that hydrogen might be effective for this therapy. So with this rationale in mind, we have already devised a study protocol for conducting a multi-center clinical trial involving 4 centers. This is a study also led by Professor Nanshan Zhong and is anticipated to be initiated very soon, at approximately June this year. So I will very briefly describe the study design. So this is a randomized double-blind study, okay? We will use 2 groups. One is a treatment group. The instrument that we see here, generating the mixture of hydrogen and oxygen mixture. And we also plus the daily usual care. So what about the control group? We use the oxygen inhalation. Why? Because this instrument is also capable of producing the mixture of hydrogen and oxygen. Because oxygen might also confer a certain degree of efficacy, we need to serve oxygen as a control group to fully demonstrate that all these efficacy are solely related to hydrogen, but not the mixture of hydrogen and oxygen. Okay? So the duration of this treatment will be 12 months. And we have already scheduled at least 7 visits. Throughout the visits, we'll compare different clinical variables, of which the rate of bronchiectasis exacerbation should be the primary endpoint. Nonetheless, we will also determine the different secondary parameters, including lung function, the quality of life, sputum volume, as well as the sputum bacteriology. We'll also place great emphasis on the adverse effects. So hopefully, when these studies are already performed, we might be able to demonstrate the efficacy in the next couple of years. And we do hope that the hydrogen inhalation will prove an alternative way to very debilitating respiratory diseases, such as bronchiectasis. Thanks very much. And also because Professor Qingling Zhang was about to deliver her speech, however, because of delay of her aeroplane, so I have to deliver a very brief introduction on her behalf. So she is a principal investigator of the clinical trial regarding the hydrogen inhalation therapy on patients with severe asthma. So as we know it in our clinical practice, severe asthma represents a very difficult to treat subgroup. This is a treatment strategy proposed by Gina, okay? So typically there will be a step-up therapy. And usually patients with severe asthma require higher steps and more severe treatments. So this truly represents a very typical group that needs particular clinical attention. So indeed, there are some very clear distinctions between patients with severe asthma and non-severe asthma. So by performing a principal component analysis, Professor Zhang and colleagues were able to show that the patients with severe asthma, as demonstrated in green dots, as compared with patients with non-severe asthma, displayed in the red triangles, that these dots could be readily discriminated between the plots. So there are some clinical parameters such as lung function and other parameters that are very easily used to then discriminate these two patient subgroups. In clinics, severe asthma at least represent 5 to 10% of the asthmatic populations. These patients usually require higher doses of inhaled corticosteroids. So also very similarly, there are very limited approaches and also including the very effective approaches. So we do have some very other mechanisms that are able to demonstrate why some patients are particularly vulnerable to have severe asthma, as some just develop non-severe asthma, of which the oxidative stress plays a very significant role in the pathogenesis of severe asthma. Because of the limitation of the time, I will not describe them in detail. However, we should know that oxidative stress is a very key marker in the development of severe asthma. So with this in mind, could we infer or treat the oxidative stress by hydrogen inhalation? So with this in mind, we have also devised this clinical trial using the atomizer that I have introduced to you several minutes ago, using the hydrogen and oxygen inhaled therapy. So this is also a prospective multi-center clinical trial. We also performed a double-blind randomized control trial with approximately 150 patients enrolled in the study. So these are the 6 sites that will be participating in this multi-center clinical trial. And also Professor Nanshan is the lead author of the whole investigation. So in the experimental group, the subjects will receive their routine treatment, plus the inhalation of hydrogen, oxygen, and mixture gas. The method is by inhalation, okay, 3 minutes per liter per minute, and patients will inhale for 3 consecutive months. As for control group, we only require patients to receive routine treatment plus the inhalation of oxygen, okay? Why inhale oxygen? I've already introduced rationale before, okay? And also the flow rate is 3 liters per minute for treatment of 3 months. So what are the main endpoints? The primary endpoint is the mini AQ-LQ score. Secondary endpoints include other quality of life measures, the lung function parameters, the exacerbation of asthma, the airway resistance, and other systemic markers. So this is a flow chart, okay? So study from recruitment and to reassessment, and there is also a re-evaluation after the cessation of the treatment. So we will be able to show not only the efficacy during the treatment, but also after the treatment. So what are the expected results? We hypothesize that hydrogen inhalation might increase the quality of life in patients with severe asthma. Secondly, inhalation of hydrogen might be able to decrease the frequency of acute exacerbation of asthma. And finally, we would hypothesize that the hydrogen inhalation might reduce the inflammation of the airway and also the oxidative stress markers. So these might be one of the most novel results of the study, and which are expected to be delivered to you some years later. Okay, that's all my presentation. Thank you all for your attention. Thanks.
presentation. So present by Professor Zeguang Zhen, who is also coming from the Guangzhou Institute of Respiratory Disease. Please, so notice the time limitation, please.
Thank you, Professor Zhong and Professor Guan, ladies and gentlemen. Today, I will present a research project here about hydrogen oxygen nebulizer machine as an adjuvant therapy for severe stable COPD patients. This is a multi-center randomized parallel controlled double-blind clinical trial. The experiment has been authorized by our hospital ethics committee. And instead of clinical trial, the sample size is 140. The principal investigator for the whole project is Nanshan Zhong. The lead site is Guangzhou Institution of Respiratory Disease. I'm this part principal investigator. There are 5 other participating sites and 5 research. They are Jiang Shangping, Chen Weipeng, Liang Zhong'an, Cao Jie, Yan Xixing, and Shanghai Asclepius Meditech is the sponsor. In our research, the objective is to study the clinical efficacy and safety of hydrogen oxygen nebulizer machine as an adjuvant therapy for severe stable COPD patients. The method of the research, the patient will be divided into 2 parts. One is experiment group and another is control group. In the experiment group, the patient will be given conventional treatment according to the group, and the patient will also inhale hydrogen and oxygen both. The machine produced by Shanghai Asclepius Meditech. The oxygen and the hydrogen and oxygen proportion is 2 to 1. The flow is 3 meters per minute, and 1 hour a day, twice a day for 3 months long. In the control group, the patient will also give conventional treatment according to the goal. And the patient will only inhale oxygen. The flow is also 3 meters per minute, 1 hour a day, twice a day for 3 months. The major assessment is modified rate medical research council. The secondary assessment is St. George's respiratory questionnaire, 6 minutes walk distance, pulmonary pressure measured by heart Doppler ultrasound, lung function, artery blood gas analysis, electrocardiogram, sodium biochemical, and liver function, renal function, and cardiac function. The result of this research will be expected. The hydrogen and oxygen will improve the life quality of the patient, reduce the incidence of the exacerbation in COPD patients, improve the lung function, and relieve the inflammatory response. Thank you for your attention.